So our next speaker, when I messaged him for this talk and saw his social media, I had the same gut feeling about him that I had on the first day I met him at the Xuanzhu Center. I think he was there for a Xingyi workshop. That is that here we have somebody who really embodies a particular archetype of warrior healer. This man really walks the walk, has some strong practices in several different martial arts over the course of decades, and he instantly stood out while training at the center. Additionally, he has a very successful acupuncture clinic in New York. It's really the way that he balances the work, though, that make me say that he seems like an archetype. There is a balance and clarity to watching him work, kind of a respect that he knows not only for the people that he's working with or sparring partner or training partner, but for the arts themselves. It's a really cool and impressive feeling when you get that vibe from somebody with very little information. Then, of course, see it confirmed with what they do for work, focusing on empowering their patients instead of making them dependent on outside help. It makes sense that Paul has closely followed Daoist priest and master acupuncturist Jeffrey Yuen for years and teaches at his school, Daoist Traditions, and has also obviously studied under Master Zhou as well in New Hampshire. I'm really looking forward to Paul's presentation on fertility because Chinese medicine simply has so much to offer in this area. So often misunderstood by Western medicine or slapped with some hormone or some catch-all treatment that really comes with its own set of side effects. Chinese medicine actually has a huge advantage in dealing with fertility for multiple reasons. For one, they have thousands of years of documented research and practice versus only the last few hundred years that Western medicine allows to be reviewed for as research. And for the other, Chinese medicine is adept at describing dynamic cyclical processes, while Western medicine often takes these cycles and tries to make them static or separate them in order to study them. Chinese medicine embraces relativity and the undeniable fact that multiple systems in the body are in flux at any given time as part of a one whole. And this emphasis on a wholeness is a huge asset in trying to optimize and enhance fertility outcomes. So, without further ado, I'm going to turn it over to Paul Alexander.
Sam, did that go through? Okay. I can't hear you, so hopefully you guys can hear me. Okay, all right. Sam, again, thank you for that humbling introduction. I just wanted to start by saying when I received your text, it filled my heart because we had a quick moment where, you know, you were on your way out of the Daoist Gate Center and I could see you were in a rush, but I was kind of like lost. And you took a moment, you got out of your car and you welcomed me open-heartedly. So when you got in touch with me, it was like I just said, this is awesome. Regardless of my commitments, I'm going to make this happen. So you as a representation of yourself, but also Daoist Gate, but also this community of fellow practitioners as martial artists and healers. So humbly, thank you so much. And also moderating and organizing this. Master Joe, I'm so happy to be part of this. For those of you watching, I would highly encourage one of his intensives. When I think about the Xingyi experience, my legs still hurt because they're quite intense. I had the privilege of studying with him at least 4 times during the shutdown era we had. I took my partner there and then I took my son there, and we all loved the experience. So I can't encourage any of the viewers to enough to go visit his training center and to learn from him. Spectacular. You'll find as I kind of present my topic here, I tend to tangent a little bit. Bear with me. I'll bring it all back to center as we move along here. I want to piggyback on 2 closing points that Professor Larson shared, as well as Sam shared. I loved that Professor Larson finalized his lecture, his presentation with connecting to the breath. Because when it comes to the notion of life and fertility and birth and death, right, it begins and ends with the breath, right? The moment we're born, the first of the primary meridians opens, and that's our lung channel, right? We take that breath in, and then we let it out in that proverbial primordial scream, letting the world know we are here. And then by contrast, in a more yin dynamic, as we're saying goodbye upon our departure, it's this finality of completion, of exhalation, of letting go, the release, right? So what happens in between that whole beginning and end? That's this phenomena, this beautiful thing, this epic saga we call life. So what is this thing we call life, right? And to continue on with what Sam ended to when he was talking about Professor Larson and Taoism, I love it so much because this is such a beautiful and highly sophisticated medicine that there are no absolutes. Everything is relative, right? And I will say that's very perhaps confrontational or contradictory to the Western allopathic model. Not that there's anything wrong with that. I do think what really is important for the success of a person's so-called healing journey is to find the paradigm and the source with which they can believe the most in. And we're going to explore that just a little bit more. But when Sam was saying that, everything is relative, it certainly is. And what I love about Taoism is that there are no absolutes. My fascination and my commitment, my devotion to the Tao and Taoism is because there are no absolutes. And it's about exploring infinite possibilities and infinite potential, exploring this thing we call the human saga and the human potential, and how do we maximize that, right? So the headline that I was gifted to present was this notion on Chinese medicine and fertility. And as my students at Daoist Traditions will tell you, even though I teach over there advanced orthopedics, that's the headline. But I try to encompass a lot of the philosophical lessons that I've kind of utilized in my practice from Chinese medicine, as well as Taoism, as well as all the wisdom traditions. So the way I would kind of cite it is that Chinese medicine is applied Chinese philosophy, right? So while we are going to discuss to an extent the notion of fertility and conception, it's really just a system that can be kind of applied to all aspects of life. Conception meaning to conceive or to birth an aspect of life, whether it is literally a baby or figuratively and metaphorically something we want to manifest within life, right? What I love about what I do as an acupuncturist is that the roots of what I'm offering is the energetic application, right? And energy is everything, and if we can tune into that, we can then begin to manipulate that, right? So I'm going to follow along my little outline here. So I just would like to share that, again, to piggyback on Sam, that this is my own clinical experience of how I would proceed when someone, an individual or a couple comes in with the request to help with fertility or infertility, or the notion that they want to have a child in their lives. This has kind of been my mystical, my own personal anecdotal clinical experience. Every one of us are going to have a different one. And what I really offer is that find your own way, find your own Tao. There is no one way. What is interesting, though, is as a newbie, as an intern, when I began my studies at Pacific College of Oriental Medicine, this was back in 2005, I did get a lot of patients coming in for fertility treatments. So as a student, I would follow the so-called protocols, like opening lung 7, making sure to do Zhigang Shui, all these things that would help encourage the optimal, I think, effectiveness, especially in the women's menstrual cycle. And then as the years progressed, when I opened my own clinical practice, I found myself kind of doing away with that and exploring other ways to entertain the possibility of helping the person conceive without necessarily finding a protocol. So I'm sharing this because what I'm inviting you, the listener, to do is to take whatever kind of shares that I'm offering and make it work for you. Nothing is absolute, like we were saying about the beauty of Taoism and Chinese medicine. Everything is relative. So maybe it will kind of ignite some kind of epiphany or give you a challenge to the way you think about things. And that's all a beautiful thing. Okay. So again, forgive the tangent here, but what we're talking about is this notion of life. And this begs, I think, to an extent, an understanding of what that is. I love the word soul, and that's what we're going to begin to explore, because we have this incarnation, this phenomena that comes into being with the first breath, actually upon insemination, right? And regardless of ideology, the concept from a Chinese medical perspective is life begins once insemination occurs, right? The sperm meets the egg, that's where life begins. We'll get into that. But the soul, I would like to offer some working definitions of this. It's not a singular entity, but it's a complex, multifaceted concept. It's conceptual here. Before we do that, when I work with a client, so I'm using the example of fertility as our kind of outline, our focal point. But I always like to sit with them and I like to get to know them, and I ask them, what is the goal, right? So from a 5-element perspective, I really begin with the wood temperament. Wood is about establishing a level of certainty and goal setting. It's a directionality, right? It's about growth. It's about planting a seed and allowing it to blossom. So I like to make this clear. It's by no means the fulfillment or the achievement of that goal. It's about providing a level of clarity as far as like a North Star that we have a directionality now to move with, right? So in the case of fertility, they'll come in and they'll say, my husband and I, or some individuals doing embryonic transfer, they come in individually. The goal, so to speak, is they want to get pregnant, right? And again, this can be extended to anything. If we want to conceive or rebirth any aspect of our life, it's essential to start from that wood element paradigm, setting up a dream goal and objective, okay? Despite our own natural tendencies, whether, if you look at my face based on physiognomy, I'm more of a rectangular, I'm more of a metal type. So establishing goal sets, that's actually not my natural tendencies, but goals are helpful in the sense that it establishes measurements so we can see how far or away we are from achieving that kind of that kind of journey. Second of a criteria when a patient comes in, I personally, after almost 20 years of walking down this path of healing with other people, I try to take myself and patients as much as possible out of the intellectual domain, out of the intellect. I have personally found it to be a very challenging place to be if they're not willing to embrace the emotional aspects, the feeling aspects. I'm always reminded and reminding my students that the distance between the head and the heart is short, but it's the longest journey we'll ever take. And I love this Daoist concept of Shen Yi, where it's the goal set, if there is one here, is to unite the phenomena of the head and the heart so we can navigate life from that perspective holistically, as opposed to the intellectual terrain, which is, I will repeat again and again, it's a dangerous place to live from. I'm always inviting people to embrace the magic and the mystery of life, because that way there's no boundaries, there's no fixations, right? It becomes more relative, right, and experiential versus the dogma and the headspace that a lot of us live from. And by the way, when it comes to fertility, I have seen the intellectual approach as one of the most disastrous and limiting processes that will influence the success or non-success of that whole infertility process or fertility process. So again, step number 2 when I'm working with a person is get them the hell out of the headspace and into their heart, away from the intellect and into this embodiment of the soul. And that's one of the definitions of soul, is the embodiment of the spirit. And it's governed not so much from the rationale and the logic and the thinking paradigm and perspectives, but more from the feeling sensation. I love one of my colleagues, one of the things he'll always chat with me about is it don't mean a thing if it don't have that ling, right? And ling is the Chinese definition of soul, right? So we want to kind of linguify, we want to feel as much as we can when we go through the process of manifesting and conceiving a life or anything it is we want to bring into our lives. Okay, again, the third criteria, I said it before, bringing back the mystery and the magic, like letting go of fixations and boundaries and embracing this great journey we have with the notion that anything is possible. Okay. So when it comes to, and again, I want to continuously repeat, I understand that I tend to get repetitive sometimes. And my argument with that is, one, I enjoy repeating myself. And 2, there's an alchemical statement that through repetition, the magic is forced to rise. We know this as martial artists. We know this as clinicians. The more we do things over and over again, there's some substantial essence that formulates and compounds as we do it. So forgive me for those that are just getting to know me, right? But you'll hear me repeating things over and over again. That being said, I have a belief, and Sam, again, thank you so much for saying the archetype, the healer and the warrior. While I've never thought of it that way, I think I guess I'm going to acknowledge that now, and thank you again, that I do believe that the healing arts and the martial arts are truly 2 halves of the same whole. They really are. As healers, as clinicians, when a patient comes, for whatever reason they're in there, ultimately they're in pain, they're in some form of need, they're suffering. So in a way, as warriors, we need to combat and help them alleviate their pain to an extent, whether it's learning how to work with it, embrace it, but this kind of mindset, so to speak, of seeing the martial arts and the healing arts are as 2 halves of the same whole, I bring that up because I do treat in my clinical practice a lot of martial artists, specifically professional martial artists in the world of MMA, right? And having done those arts myself, but also coached them through before their and after their fights, what always gets brought up is that you never enter a fight. One never enters into a fight thinking they're going to lose, even if it's a world championship, right? And they're facing at the highest levels the scariest opponent that in their mind they may be defeated, right? The moment they step into the arena, if they enter that they could lose, if they enter that possibility, they've already set them up for failure. Okay, so when it comes to fertility and when it comes to any aspect of healing, doubt is the nemesis. Doubt is the enemy. So the so-called pugilistic fight is how do we defeat doubt, right? We don't let failure enter our mind. That's not to say we're not naive. Things may not work out. But as a martial artist, we kind of embody that kind of warrior archetype, that mentality that we can do this, right? It's a better pathway than to say this might not work out. The moment doubt enters, we're already in that kind of possibility terrain. We don't want our psyche going in that direction, okay? So in other words, when a patient comes in and we're navigating through this process of fertility or infertility, in my mind, when anyone comes in actually for any kind of presentation, whether it's a terminal situation or something quite difficult or pain or something orthopedic related or infertility, in my mind, I see them as already happy, healthy, and whole. Okay, so within the context of fertility, I see them as already pregnant. I see the couple, or if they are a couple, having beautiful children, dancing all around them. So I'm already kind of conjuring up from that mystical terrain, that possibility. And really, I want to invite the patient to constantly do that as well. I do believe that thoughts are things. So the more we begin to think about that thing, it draws in that possibility, right? It's this unique power of our yi to summon focus, right? What you focus on, you feel, right? So if you were to feel I'm successful in this endeavor, meaning I'm pregnant or whatever it is they're trying to manifest, you're already beginning to feel that success, that victory, so to speak, right? As opposed to the opposite. If you're, oh, this isn't good, the doubt terrain comes in, it's shifting the focus away from the desired outcome. So again, the clinical work is how do we develop focus? Meditation will get us there, and we're going to talk about that in a moment, right? The other thing about focus is that metaphysically, not only what you focus on do you feel, what you focus on you move towards, right? So I really, especially before the needling process, I have the patient really begin to feel what it is going to be like to get pregnant in this case, right? For the female patient coming in, I have them place their hands on their belly region and just feel like they're already pregnant, right? Okay, so some kind of things I want to discuss, and I don't mean to be contentious at all against Western medicine, right? It's never my job to kind of, despite my personal biases and beliefs, I am wholeheartedly devoted to Chinese medicine. But when a patient comes in, I'm in full support of whatever modality they're going to use. The critical concept here is what do they believe in, right? And the two concepts and notions I want to kind of discuss really briefly is the notion of the placebo effect and the nocebo effect, right? If we look at the etymology of the word placebo, it comes from the Latin placere, which means to please. So it's this notion that we are going to take this clomid, this drug, whatever it is, and it's going to work. It's going to have an efficacy. It's going to work. And the FDA now acknowledges at least 40% of the time, 40%, the notion of this chemical component, it's going to work not necessarily because of the chemical component, but because of the belief in it, right? So that says a lot about the power of our minds. If we believe it's going to work, it's going to work. So I'm trying to use this as a validation to what I'm talking about here. This power of focus and belief, whatever it is we're in for healing, again, specifically in fertility, we need to believe it's going to work. This is in opposition to the nocebo effect, right? Where some of us are familiar with this when a physician comes in and says, sorry to report you have cancer, you have about 2 years to live. That's the nocebo effect. And if you look at the literature and the research behind that, it's almost mind-boggling and scary to see that patients actually will fulfill that sentence, right? So I do my best to not entertain the nocebo effect at all, but also this discussion is intended to illuminate that words have power as well as do belief systems. So part of this inner process of meditation and however we're going inward is to kind of get very clear about those other external voices and to figure out what's true within your own sense of self. right? And to not take on other agendas, meaning like if there's an inclination in you that you want to conceive, you want to get pregnant, you want to trust that versus all the obstacles that have been kind of presented to you, especially from a medical paradigm, which has so much subconscious influence on our psyche that if it says, if one says the chances are low, right? There's all these limitations, low FSH, low LH, whatever, poor motility, poor mobility in the case of men's sperm, that can have serious nocebo logic effects. Okay, so we want to become clear of that. So this notion of belief systems, in my journey of investigating this and contemplating this, I'm like, okay, there's this notion of belief and it's really powerful. I'm a fighter, right? The warrior wakes up. What can beat that? What can defeat something so obnoxious and concerning that can influence our psyche? And I just want to say the etymology of psyche is soul. That can influence our soul so deeply and pervasively, right? It's this notion, I love it so much from the Chinese character of it, Zhongshin, this notion of devotion, right? It's this aspect where if you look at the character of Zhongshin, Zhong means center, Shin means heart. What comes from the center of your heart, right? That has been my kind of North Star, my light that has shown that if you can get into a devotional aspect where you can tune into that phenomena we call your soul or your heart, which is the home of the soul, that will trump. That is something that can help bypass the belief systems as a way if there's kind of conflicts, inner conflicts as we're negotiating these thought processes. What will trump or defeat the notion of belief? It's this aspect of devotion coming from the center of your heart, right? And as I share with parents to be, like this is essential because you are asking to bring in a soul, to bring in a Ling. We need to devote our lives to these younglings until for the rest of our lives, actually, but at least for the first few years so they don't die, right? So it's this process of devotion, right? So the sooner they can begin to apply that mindset that this is a process of devotion, first and foremost to ourselves, secondary to our children, the whole thing becomes magical and mystical. And that's really the terrain that I personally love to operate on versus one that has definitions and fixations and boundaries. Okay. So I just want to conclude again, repetition that the takeaway is that I do see it clinically that Western allopathic medicine in its notion of the need for research and research and measurements, right? It creates fixations and boundaries. So just be aware that that creates a level of, I would use the word stagnation in a whole process of conception and manifesting. Okay, so let's backtrack a little bit before we get into the specifics of fertility and talk a little bit about this notion of soul and soulfulness. I'd like to offer you guys 3 definitions, right, which will help the whole process of conception, okay? The first one is I define the soul as the consciousness within, right? It's this voice, if for lack of a better word, this inner knowing, right? That there's something exists as an internal process that can allow me a level of completion, meaning that there's something in me that needs to be experienced this life. How do we get clear on that? How do we change? How do we get clarity on what that is, right? The way you do that is you get still. And I loved Professor Larson's examples of that, calming the mind, right? And allowing yourself to feel what arises. What I will respectfully debate is this notion of desire, right? If we look at the etymology of the word desire, and by the way, I was raised as a Theravadan Buddhist growing up. I am now a practicing committed Daoist, but I understand the Buddhist notion that desire leads to suffering. But if we look at the etymology of the word desire, right, it's broken down from ancient Latin, desir. De means of the, sir refers to the father. So what the ancient Latins are referring to is there is a spiritual connotation, a spiritual pull, if you will, that you want something. Again, it's not by any means the desired, it's not about achieving that desired want or outcome, but it provides an experience that every one of us needs to have so we can complete this journey, this soulful process. Okay, so when it comes to desire, I do feel respectfully that there is an important place for it, right? The notion of getting pregnant, yes, we can define that biologically. There's a biological tendency in women, and men have that too, that they feel something within them that is kicking, that is saying, I want to come through you, right? That's not even acknowledging the metaphysical aspects that there's, from a Daoist perspective, pull and energies around us that are communicating with us from other dimensions, right? But there's this inclination that we want to have an experience. And the only way we can get clear to that is to clear on that is to go within, right? So the first working definition is the consciousness within, okay? That's why I love acupuncture so much, because acupuncture, it's an internal process. Like these needles face the patient, right? So they go in and it invites the patient to have that inner journey of reflection, that time out of stillness. So hopefully something else can emerge. And that something else will be what needs to get done this life, among other things. But acupuncture is an internal process. That's why I will constitute it and qualify it as a soulful process of healing, that being acupuncture and Chinese medicine. Okay, definition number 2 would be the embodiment of the soul is the embodiment of the spirit, right? So we've got something tangible, right, coupled with something intangible, something material coupled with something immaterial, right? So from a Chinese medical perspective, we would say that tangible aspect would be the jing, the genetic component, the solid, the root, coupled with something immaterial. From a Taoist perspective, now we would say tian, something from heaven. These two forces merge and life begins, and you have a human being now. So that's definition number 2 of what a soul is, right? And as we close towards the end, we're going to talk about ways we can refine and enhance one's jing, one's essence, so we can increase our own vitality, but within the process of fertility, we can really offer our children the best chance that they can have this life. By making us strong, we can pass that so-called seed onto them, okay? Third definition, which is my passion, right? This is the Chinese character Ling Soul. And I'd like to, if you guys would entertain me, take us through what my understanding of Ling is. And then from there, we're going to move into fertility as a specific. As we go through here too, I'd like to offer some Daoist cultivations that I have learned from Master Jeffrey Yuan, who's an 88th Daoist priest of the Shangqing order, a phenomenal instructor as well. But let's talk about this for a second, because it does inform us of the fertility process and of life itself. Okay, so again, the character Ling, broken down into 3 radicals. There's actually more, but 3 radicals we're going to discuss here. Okay, the first radical, Yu, right? Hopefully you guys can see that. Yu, it means rain. Thank you, Sam. So the first radical, rain, right? So a couple of analogies and metaphor to that. One, it's this unique metaphor and analogy of the concept of water. It's the virtue of all Taoist practices, right? It's this energy, it's this phenomena that goes to the highest place, right? We call that Tian, or heaven, right? It gets condensed, it goes to the clouds, and it rains down upon earth, right? And then as it does its thing, it has its earthbound mundane experience in earth, it hits the ground and it goes very deep, and then it begins to evaporate, and it goes back up and down through this process, this cyclic process of transformation. This is one of the kind of philosophical arguments of reincarnation, right? In that water, we know, holds information, okay? And I was very inspired by the works of Dr. Matsuro Emoto. I got a chance to apprentice with him for a few months over at Pacific College years ago while he was still alive. Just for those of you who don't know, this is fascinating and very pertinent to the utilization in fertility, right? Where Dr. Emoto, just to kind of really simplify his research, but what he did was he took 2 case samples of water. He said to one sample, I love you. He said to the other sample, I hate you. To the same sample, thank you. To the other sample, no. Okay, so I must respectfully say he was of Japanese ethnicity. The Japanese, forgive me, not the Dr. Emoto was very kind of non-emotional, very like that, right? Kind of hard to read. So I bring that up because when there was no emotion involved, it wasn't like my French friends that they look at the water, and then I've had them do this practice. I'm thinking of a French baker that would bake his bread in the morning. He's like, oh, Paul told me this, and I love je t'aime, and he's breaking his bread, and he's saying, I love you to the bread. Anyways, and by the way, he's a very famous baker, so it definitely works. But you know, that this shows that water holds information, because he put both of them under, both samples in the freezer, and then later on under a microscope. And what he found with the I love you feedback, all the molecules were cohesive. They were molecularly joined, and they all formed crystalline structures, right? With the I hate you and the no feedback, the molecules were not, they were disjointed and not one crystalline formation. Okay, what this illustrates is that water has the capacity to hold information. It holds vibration, right? So this is one of the kind of I guess the thoughts of how reincarnation occurs, right? So this incredible thing called rain and water. Now, again, to tangent a little bit, when we're dealing with conception, I will always have both the female and the male, if they're doing this from a hetero perspective, if they're doing this au natural, meaning that there's going to be copulation there, I will have them say I love you a lot during the process of intimacy, and specifically around the region of the uterus and the ovaries, and between looking each other's eyes being the gateway to the soul. I'll make sure to really encourage them to use these words and utter them even if they're not feeling it. Just the vibration of love is such a beautiful thing to not just during the process of conception, but just as a reminder that love is around us and to be beautiful, but also to kind of enhance, we are easily over 70% water. So to enhance the water within us as well. There's a powerful healing force with love. We all know that. Okay, so again, so water. All right, so that's one of the kind of explanations of this phenomena something more literal when it comes to Ling and life is this act, this sensual act of copulation, where the male is penetrating the female, and there's an act, we all know what that is, right? And there's a finalization of that act where the male will ejaculate and there will be an explosion, right? So the male orgasms, and that semen then goes into the female. And from there, the philosophical perspective is life begins, right? So when that explosion occurs, the belief is that three portals, right? So we're looking at the middle radical, right? Three portals open: the Po, the Hun, and the Shen. Okay. The Po, we would define that as the corporeal soul. Okay. And again, one of the philosophies that's been presented to me is that there's souls that are in another dimension, for lack of a better explanation, and they are very attracted to couples in procreation, right? And as this is going, these souls, these energies, right, they're looking for a physical body because they need to take physical form. So that's the first portal that opens, is the Po, right? And that's what we would call the corporeal self, and that's what we want to begin to get very curious about, because it's through the physical body that that life can occur. Okay. Next portal here is the Hun, right? The Hun is the ethereal body, right? So the Hun is represented by something that is timeless. Forgive me, from the Po, this relates to the lung and the large intestine. For those of you that don't know Chinese medicine, right? The Hun relates to the liver and gallbladder. Okay, so this is about time and space, but also about transcending, doing things this life that transcend time and space. It also has to do with purpose. There's a reason for existence, right? What is that reason? That then births the third portal. That third portal is the Shen, okay? A way that it's been defined to me, Shen can be considered the lesson plan, right? Each one of us as a soul has a specific lesson plan, something we need to do or experience this life, right? So these Po are looking and observing people in copulation so that it can have a physical form, and they're feeling the vibration, they're feeling the magnetism of these two people, that they are kind of predicting, a la the Hun, through time and space, that they will provide the template for the ideal experience for their souls to have what it needs to have as a form of a curriculum and experience, right? Which again leads to Shen. Okay. I want to close on this real quick, and then we'll get back to some cultivations we can do with the Po, the Hun, and the Shen to kind of get curious about what this is and how to tap into these dimensions. Okay. The final radical, which is my favorite one here of the character Ling. Okay. We see the upper radical, the upper line here, the horizontal line, and beneath that, the lower line here, the vertical line. Okay. So we can call this heaven and earth. There's a bridge that connects heaven and earth, right? By the way, this upper line, this lower line, and this bridge, as a standalone character, it means gong, right? Gong, as in gong fu. It means effort and work. what the ancients are also alluding to, I mean, this is so deep, we can spend the entire hour talking about this character. I'll stop soon. But what their ancients are conveying is that it takes effort, it takes work to be a human. And I get the Taoist notion of Wu Wei, but we need to put effort first in order to become non-efforted. Okay, so effort, right? Then we have the human, Ren, the first one on the left. This is depicting the human looking backwards, meaning that review our lives, not just this life, but potentially the past lives, right? I love the Socratic statement, the unexamined life is not worth living. Like, from a philosophical perspective, we are here because we did not complete demands that were placed upon us previously. So we're looking here to complete something that we need to do so that we can have that return, that merge with the Tao again, from a Taoist perspective. To the other point, the yang side, on the right side here, it's the Ren, the human looking forward, right? So in this life of ours, we have this notion of looking back and looking forward, this notion of where am I going, this notion of destiny, okay? Now, this character as a standalone, this bottom radical, this is the character Wu, which in Chinese means shaman. Okay, so the line above, connecting to heaven, the line below, connecting to D, earth, the human looking back, reflecting on one's life, not just this life, but past lives. The human looking forward, where am I going, right? What is that, right? So they discuss this philosophically among those people in that time period. What is this notion? Wu, Wu, like, what is that? Wu is an utterance. Wu literally means, on a literal level, Wu, I don't know what that is, right? So what this is, again, it's a reminder that it's meant to be a mystery. Life is not meant to be like known. It's meant to be fully embraced as to like, what are the possibilities here? And I love ending with this one because that shamanic reminder, it's inherent within each of us. We all have these possibilities within each of us, right? And when it comes to the practices, especially the commitments and the dream goals and objective of fertility and getting pregnant, right? I always want to remind the person I'm working with is that this is a miracle. This is like, the statistics are mind-boggling. It's like 1 in a trillion shot that life occurs. It's stacked against us. So the fact that you and I are here right now, wow, like there's something otherworldly about that. We're not like, how is that supposed to happen? So it's a reminder always, philosophically speaking, to embrace this wonderful journey we're on, and not always to seek a definitive answer. Like, I get it, the mind wants to be stable, it wants to be grounded. So we need to know to a certain extent, so we're not kind of dancing with our heads cut off. But at the same time, just recognizing there's so much beauty in the not knowing, and just allowing life to unfold as organically as possible. Okay, I know we're getting close to time, so again, I just wanted to, this is kind of like the overarching philosophy. And again, from my clinical experience, Chinese medicine is applied Chinese philosophy. So even in my clinic, when patients come to see me, you'll hear it time and time again. Even with acupuncture, we might not even get to the needles, right? So I've found like discussions like this can be so rewarding. That's enough to kind of open those doors of possibility that conception can occur, right? It's a transformational discussion I'm hoping to engender and provide for you guys by kind of offering maybe something that you didn't know before, or maybe going a little bit deeper in things you did. And if you know them already, it's that notion of repetition, like remembering through repetition, the magic is forced to rise. Okay, so let me get to the specifics now of fertility, okay? So the couple, so to speak, or the person is looking to conceive a life. Okay, so what you do in one terrain, better yet, I will say what you are cultivating in one terrain, everything else becomes an extension of that. So when you're dealing with the process of creation, my encouragement always is do things that are creative. Be creative. If you're an artist, paint something. If you're a singer, sing. If you're a martial artist, do your forms, fight, right? But be creative. Awaken and arouse that creative force of life, right? Because energy is it's contagious. We want to have that energy constantly permeating our all our faculties and our bodies and everything around us. So as much as possible, be creative, be silly, but let go of the tension that life has presented to us through this crazy journey we're on, and return to that like childhood innocence, because we're trying to attract a child. We want to be a child. That notion of like attracts like, right? Become childish again. Okay, so in terms of a wellness hierarchy, um, I do believe it's been my clinical experience that there is a hierarchy here, right? So in the order of importance, I will say sleep, diet, movement, lifestyle, right? So prioritize sleep first and foremost. What I will always share with the patient is that if you're not sleeping, you can't heal, right? It needs to be prioritized as much as possible, and allowing yourself to align to the circadian rhythms is very helpful with the process of fertility. Okay. Um, Ideally, so the liver can be fully, I think, regenerating and enhanced, right? Getting to bed by 10 p.m. and then allowing yourself to wake around the time that the sun comes up in your time zone. That will help to align yourself to this so-called circadian rhythm. Okay, so from a sleep perspective, everyone is unique and has unique kind of demands. So I'll just say, just know that sleep is very essential. Okay. Second is diet. Again, it's a very subjective thing. I will say quickly that when it comes to fertility, from a male perspective, right, we want to really work with and consolidate and enhance the jing. So eating jing-rich foods, right, specifically black seeds, bone broth soups, meats with the bones on it, things that kind of build the jing will be very helpful. For women, two things in particular. I think fish are wonderful, right, due to the omega-3 components, but also this notion of something very yin-like in nature. Um, Fu pensa, which is the Chinese word for raspberries, right? So ze, when you see the word ze, it always means seed. So again, we want to plant the seeds of possibility. So that raspberry, as it's been found in Western findings too, it enhances and strengthens the uterus and the uterine lining. So that's whether it's a tea or fresh, I would encourage female participants to eat raspberries on a daily basis, or at the very least, have raspberry tea. Now, with both things, I neglected to say, I forgot to say that intentionality is a very strong component of this practice. When you're eating these things, the intention is I'm doing this to get pregnant, right? I'm doing this for fertility, because that's going to kind of guide that energy in the direction you want. Okay. I want to throw this in. I don't encourage this anymore, but I'll never forget this suggestion. I found it very interesting. When I was at Pacific College, one of the fertility experts there suggested have the female eat eggs, but as opposed to what I would do, I look for pasture raised, natural, organic, all that wonderful stuff. She suggested get the ones that are just that are laden with hormones. And her belief system was that when you eat those eggs, you're gonna, as a kind of a little bit of a signature, you'll get those hormones within you, right? I did that a lot during my internship. I wouldn't do it now, but I just wanted to throw that in there, that I think it shows maybe the power of the mind. Like I would explain that to them and they would eat it. Perhaps it's the mental component that they would believe that this would help. I just wanted to throw that in there. Two more things when it comes to movement, a little bit of lifestyle, because I do want to get to cultivation and questions if possible. Because I do see a lot of professional athletes and living in a city like New York, people are very stressed out. When it comes to physical movement, right, the third component, sorry, so we've got sleep, dietetics, now movement. For whatever reason in this culture, there's this mindset that more is better. That we all know that's not necessarily the case. So I just want to differentiate. There's this notion of working out versus working in, right? Working out is what most people in contemporary society are used to. Go for the run, do a little boxing, do a little sparring. That's energy expenditure, okay? That for some people is good, is important, but the balance point to that is working in, doing things that are slower and more gentle, right? So it takes less energy to do. It's almost like when you're doing something like a 5-element approach to Qigong, it feels like you want to move quicker, but you're not letting yourself do it. That's going to build and enhance this Qi dynamic. And that's really critical, because working in is the yin aspect. It's the balance point to someone that has that kind of driven go mentality. Okay. And what I will always say to everyone, but specifically to those athletes, train, don't drain. I am guilty of this myself. I've been yelled at many times when I'm on the floor huffing and puffing because I've got nothing left, but never train to exhaustion. That's a big consideration that I really want to emphasize, especially to the professional athletes that might listen to this. Train, don't drain. Okay. That's it for me, Sam. I just want to maybe go over really quick, just because I was asked to, 3 cultivations, okay? And Sam, can you give me a quick nod? Do we have time for maybe? Okay, all right, thank you. 3 cultivations that will entertain the notion of Po, Hun, and Shen. I said before, the Po is the important aspect, right? By the way, couples that are trying to conceive, I would recommend drinking white tea. White is the color of the Po. We know this from the elements, right? Lung and large intestine, white is the color. Again, intentionality is everything. So I would ask the couple to believe, right, that the white tea will invite the Po, okay? Po is a dimension. It's a transitional dimension between the living and the dying. And the belief is that there are energies, right, souls that need a physical or corporeal sense of being, a corporeal soul. So one of the ways to tune into that dimension that I learned from Master Jeffrey, it's a shamanic cultivation where you would actually be lying down. It's one of the few ones that I learned that you're in bed lying down. Everything is dark, right? So typically at nighttime. And what you do is you allow yourself to drift off. You close your eyes, feel very heavy, feel very sleepy. The moment you feel in a relaxed state that you are drifting off, you gently allow your eyes to open, right? And you acknowledge with a level of awareness, I'm awake. Then you close your eyes again and you let yourself slowly and gently drift off. And you let yourself oscillate like that, right? What you're attempting to do is to hit that in between space, right? It's the metaphor, the analogy, the philosophy is the Po dimension is the dimension in between, right? Between the living and the dying. So that's one of the techniques. I know I'm rushing through that, but I wanted to say that's the one possibility. I offer this as a general practice for most people that are going through the fertility process as a way to kind of, from a practical standpoint, I treat a lot of stressed out people to get them to relax. So there's a practical aspect to this by just like, even if you don't believe in the notion of these possibilities, just from getting them to like close their eyes and to feel again what it is to drift off, and then to summon a level of power to open it up before they drift off. They're tuning into their physical body, which is a beautiful thing. And most importantly, they're de-stressing, right? So there's a practical component to this too. I'm more invested and believe in the metaphysical and the spiritual components. What will happen is if you're able to tune into that, things will get very fuzzy. It will get very psychedelic, right? Things will get very white, actually. One of the definitions Master Jeffrey gave about this, he calls it the white cloud or white noise meditation, because you actually begin to see white. Remember, white being the color of the Po. So that's one of the measurements that you know you're entering that dimension, right? So that's how we work with the Po aspect of the soul. The Hun, right? The Hun relates again to the liver and the gallbladder, right? Which both go to the eyes, right? And we know the eyes are the gateway to the soul. So eye exercises, okay? So the way, again, forgive me, I'm rushing this, but the way this is done is, as Professor Larson encouraged people to sit up, this is where you would be seated. You would get very relaxed. And what you would do with your eyes closed is you would start in the center position, right? And your eyes would be closed, but I just want to show it with your eyes open. You're going to look up, right? To Tian, to heaven, look down to earth, up, down, right? Up and down. You would do that with your eyes closed 100 times. 100 representing numerologically new beginnings. There's completion with a new beginning, okay? The vertical axis represents space, okay? Then we're gonna tune into the horizontal, the horizontal axis, left, right, left, right. So you return to center, keeping your head still, your eyes are closed, you're looking left and right 100 times, okay? Returning to center, then we do the diagonal axis, spinning left to right, 100 times, returning to center, right to left, 100 times, returning to center. We finalize after center 10 circles in a clockwise direction, 10 circles in a counterclockwise direction, okay? And again, I apologize. I know I rushed through that a lot. That would be how to cultivate an attunement to the Hun dimension. The Hun dimension, if I didn't say it before, it's the ethereal soul. So it requires an elevation of frequency and vibration. It also requires kind of an attunement. So this takes time and practice, but that would be how you would tune yourself into the Hun. We're going to close with the Shen, okay? The Shen, I love, again, going to the etymology of the word spiritual. It comes from the Latin spirare, which simply means to breathe, right? So we are all spiritual when we're breathing. So I'll differentiate this between the yin kind of practice and then the yang kind of practice. The water method, which is a foundational practice of Neidan, internal alchemy, would involve the participant, namely the female participant, to focus on Hui Yin, Ren 1, right, and pull it up as she inhaled. And as she inhaled, as opposed to doing it from an alchemical perspective, I would ask her to envision something coming in to that region, that perineum region, right? A baby, a fetus. And she would hold the breath for 10 seconds in the nose and then exhale for 10 seconds out the nose, right? So that would be the meditation for the Shen aspect of the yin, the female participant, right? For the male, it would be breathing in, right? And at this point, still pulling up Ren 1, focusing the mind on Ren 8, the navel. And as you're holding there, you're going to pump it, right? So forgive me, but I don't know if you can see in and out like this, right? Pumping it in and out 10 times. And the exhale here is out the mouth for 10 seconds, right? And forgive the analogy, but it is important for couples that are copulating, right? As the male is pumping the navel in and out, it is a representation of intercourse itself. Okay, so that's what the male's intentionality is. Pump as you do this, right? And you would do this for about 20 minutes for each person. Okay, and that's the meditative aspects I would share with the patient. Yeah. I had more, Sam, but I want to close there because I know time is an issue here. So please, Sam, take over and let me know if there's any questions or things I can elaborate on. I hope I didn't go too off track there.
No, you're doing wonderful, Paul. I just wanted to clear up because I think the practices you mentioned are really wonderful manifestations that some people really might want to try. So I want to make sure it's clear.
Thank you.
You said for the Shen in particular, the yin and yang practice. The yin is for the female, the yang is for the male.
Yes.
Separate, nobody crosses over. Yeah,
Thank you, sir.
yeah,
Only for the practice of fertility, right? So
yeah.
I'm really trying to govern within the patient intentionality. So
Mhm.
I'm creating this kind of like duality, right? So that they can come together, but I'm trying to separate yin from yang.
Mhm.
For us as practitioners, if person wanted to engage in the practice of Neidan, which is how I learned that, it would be both. We should do both.
Okay.
Yeah.
Yeah, and just to touch on those methods really briefly, would the man and woman do this like kind of together at the same time, like in the same space, or
That's a
would
beautiful, thank you for that. I would leave that up to the person. I don't think that matters.
okay.
Yeah. Sam,
Well,
forgive me. I did want to throw in one more thing. I
go
forgot
ahead.
this. Men in particular, I can speak more from experience on this one. So I didn't want to forget this one. We want to, like I said before, men are invested in consolidating and building the jing when it comes to the process of fertility. Okay, what that means is it's important to acknowledge the need for seminal retention. Okay, so I want to provide the Daoist equation for ejaculation. And what that is, it's 2 times the person's age divided by 10, right? If a male was to ejaculate in accordance with this equation, there will not be a depletion of jing. Okay, so what that means is, let's say the patient is 20 years old. 2 times 20 is 40, divided by 10 is 4. What that means is this 20-year-old patient or person should not ejaculate once, can ejaculate once every 4 days, and there will be no depletion of jing. Now, we were all 20 and we would find that incredibly disappointing and perhaps challenging, right? So there are methods. First of all, I need to say we don't need to abide by this unless we're trying to consolidate and build the jing, right? So this is specific for the process of building jing, whether for cultivation or for fertility itself. Okay. The other thing I wanted to include for men in particular is that there seems to be a very beautiful benefit of weightlifting, specifically heavy weights with low repetitions. Heavy weights 2 to 3 times a week seems to increase testosterone and enhances mobility and motility in the patient's sperm, coupled with ice baths after that. Okay, so some people from a Chinese medical background challenge that. I too was taught from a TCM perspective, ice is not a good thing. It's not a good thing. It's a nemesis. But as Master Jeffrey has taught, there were schools, namely one called the School of Attacking and Purging, that used ice and hot therapy as a means for helping assist in healing. Right. What I do encourage though is don't stay in there more than a minute. right? So you see, like, especially in Western culture, for whatever reason, more is better. So you see all these, especially like the Wim Hof people, proponents, they'll get in there and they'll desensitize themselves. They'll learn to breathe and they'll stay in there for 20 to 30 minutes. Not a good idea. We know this as clinicians. You're susceptible now to cold invasion, right? So 1 minute, you want that shock. You don't want to sensitize yourself. You want to be, whoa, that's cold, and then get out, okay? From a female perspective, fat is good, right? So we live in a culture too now where like it's idolized or it's considered sexy or ideal when the female is super thin. We don't want that, especially for fertility. Like we need women specifically to enhance estrogenic levels, right? To have a little body fat, okay? Thank you, sir. I wanted to throw those in.
That's awesome. No, I really appreciate the piece on the ice bath as well, because I've always found that I'm not a body type that can hang out in an ice bath for a long time. I was an athlete for a long time, and that was always emphasized. You stay in there for like 15 minutes, and I would get hurt every time,
Yeah,
because my body in New England winter just wasn't having it. But
yeah,
I do, yeah, I always wondered because I do enjoy that little shock and I've been
yes.
to, for example, with one of my teachers, Japanese bathhouses where you're in a sauna or you're doing something that's very hot, your pores are open, and then you jump in the cold area, and it's really just like you take a minute in there.
In
And
and out, yeah,
yeah,
yeah.
and you're really not taking much time at all. And that was a totally different experience.
Absolutely. Yes. We're preventing cold invasion, and it's the Scandinavian countries are stellar at this.
Mm.
It's a hot Finnish sauna, right? And then you jump in and you get out and you go back in. So there's no chance of a cold invasion.
Hmm.
Yeah.
Yeah, no, that's really cool. I'm gonna get to questions.
Please.
What stage would you suggest it's time for the couple to move on to technology-based treatment like IVF? I'm assuming that this intention healing can also be integrated with alternative therapies, or is there a contradiction?
Never a contradiction. Like Sam stated before with Professor Larson, Chinese medicine is open to everything. It's predicated on the openness of the practitioner. With me, and I'm sure with everyone on the panel here, I get that sense. There's never a contradiction, right? So at what stage, like at that stage, when first off, from a Western perspective, it's diagnosed after 1 year of trying to conceive and it's unsuccessful, they will begin to diagnose that as infertile. In that case, I would support the decision to begin Western modalities to investigate the possibilities of enhancing and helping. I hope I made that clear. There's no contraindications or conflict, right? As practitioners and clinicians of Chinese medicine, our role is to support the journey of healing, whatever route they want to take. We want to kind of be concerned and mindful about obstacles and things that might cause damage. And we discuss that so we can inform our patients, but it's always, from my perspective anyways, to support and enhance.
Mm, sure, totally. No, I appreciate that. This next question is another interesting one. I'm intrigued by you mentioned internal alchemy practice for the female to increase fertility because I've heard that practicing internal alchemy can lead to infertility for a woman. Can you say
Yes.
more about how internal alchemy influences women?
That's a beautiful question. Thank you so much for that. It can, especially. So what I've offered are two. They're not even part of the actual practices of Neidan. These are foundational practices. And thank you so much to whoever asked that question. It was my fault I left this out. Women should not do that Hui Yin water method practice during their cycle, right? So from day one, which is this first day of bleeding, they should not perform that exercise. The menstrual cycle is meant to detoxify, to get rid of the endometrial lining. So thank you so much. You caught me right there. None of that cultivation through your menstrual cycle. The caveat, because in Chinese medicine and Taoism, there are no absolutes. If you wanted to do it, just don't pull in. Don't pull in the perineum. Just do the breath where you breathe in, hold for 10, and then exhale. But if I could just suggest, don't do it at all. Yeah.
Yeah, that's simple, simple, simple. Let me see if we have one, maybe we have time for one more question here.
Okay.
I know I had one. Yeah, I had one myself. When dealing with the patient, I certainly relate to that need to kind of pull them out of their thinking mind that provides them so much limitation. How do you do that? Yeah, what is your method? Yeah.
Thank you, Sam. Thank you so much. And let me finish on this because this is actually my passion. Um, I'm going to quote my teacher on this one. The consciousness of disease is not the consciousness of wellness. Okay. Okay. What that means is when a patient comes in and we, through judgment and measurement and our diagnostic skills, tongue, pulse, whatever, we see that there is a presentation that is out of balance, disease-oriented. They're in a specific level of consciousness. They're in a specific vibration. The work would be, how do we get them out of that vibration? How do we get them out of that frequency? What I found to be magical and entertaining and novel all at the same time is working with their names. Okay, what I mean by that is, you guys, I've been introduced as Paul Alexander. I was born into this world as Apipon Hemawikasit, right? My friends in Westchester call me Alex. My students in Asheville call me PK, right? And there's intentionality behind that. Every time I'm called something different, I feel different. My vibration changes. I also have a different personality. Remember, persona is the root for that means mask. I have different masks and hats that I wear during those different roles I play. The patient comes in, and on a subconscious, unconscious level, there is an attachment. There's a reason why they have that disease presentation, whether it's infertility or back pain. I want to use a case as a case study to share. I had a patient with ALS that hadn't spoken for 2 years, okay? And I presented this notion of a challenge of naming himself someone different. And it took him a few weeks to get there. But once he decided on a new name, I began to refer to him just by that name. And this took place in the clinical setting, and the clinical setting only. One time, again, not having spoken after 2 years, when I was saying goodbye, I said, "Bye, so-and-so." And he looked at me and goes, "Bye." And both of us dropped our mouths and was like, holy S-H-I-T. I was dumbfounded, right? It's just, that's the power of vibration and attachments and names in itself, right? We can go on and explore what that was about. But Sam, thank you for that question, because what it is it's changing our temperament, right? It's changing. It's this notion of alchemy. It's this transformational process that we're attempting to engender within ourselves and by proxy our patients, right? How do we induce a state of transformation? And I found names to be a powerful source of resistance, but also possibilities.
That's beautiful, Paul. I really appreciate this talk. You went far beyond just talking about fertility and in the best way possible. I know that even just the talk about manifestation at the beginning, I'm like, I could take that clip out and use it as assigned homework before patients come in or before certain workshops, because I think you like hit the nail on the head. It mirrors a lot of what I remember certain teachers of mine as well talking about, as far as like, how do you manifest prayer? How do you manifest intention? How do you manifest, like, how do you feel? What do you do with all this compassion that you have? And yeah, I'm really excited about this talk. So thank you for sharing it with us today.
Thank you.
Yeah, thank you for
Thank you
being
for
here.
having me, guys. It's been a pleasure.
Yeah, definitely. So that's it for the morning session today. We are going to come back, and I am actually the next speaker, coming on at 1:10 Eastern, and then we'll follow up. I'm going to talk about meridians and points in motion, and then Joseph is going to follow up with a talk on feng shui. And so I'm excited for both of those this afternoon. And so we'll see anyone that can make it at that time. And again, thank you for the morning. This has been wonderful.
Thank you all.
Thank
Thank
you.
you all. Yeah. See you. Bye-bye.